During the COVID pandemic, we unfortunately lost a lot of the progress that had been made as people were forced to stay home, away from the resources, away from the treatment that was helping them. And now we, in the past year, experienced the highest number of overdoses ever in our country, 110,000 preventable deaths. And that's why we're here tonight. In the past, we have fought against the idea that substance use is any kind of a moral failing, which it is not. We're all here to help, and we know that treatment can help, like with any illness. But when we have people dying from poison, college students who think they're taking Xanax, who think they're taking Adderall to help them study, and they're dying from a poison, this is a crisis. This is a healthcare emergency. If we had a plane carrying 300 people crash every day, we would close the airports. And so tonight we're all here to sound the alarm and reach out to our families and let them know we all have to learn, we all have to be educated about this poison.
This is how you end public health crises. Everyone pitches in, and we alert the communities, we alert our elected officials, we alert parents, and everyone we needs to chip in. They say in times of great crisis, there is no crisis more detrimental to communities than to do absolutely nothing. Supervisor DeSena, you have done something tonight. Thank you for bringing all of us together.
That's a penny, a very small object. The grains next to it represents 2 milligrams of fentanyl. Just that much fentanyl is enough to end someone's life. But many dealers are putting twice that amount, more than twice that amount, into counterfeit pills that they're selling. So if you think about that, a drug dealer is going out purporting to sell oxycodone, purporting to sell Xanax, and knowing that there is no oxycodone in there, there's no Xanax in there, there's deadly material in there. It's in there because it's cheaper for the drug dealer.
Please don't be the never my kid parents. And I urge students, please don't be the it's never going to happen to me, because no one is immune from this. It affects everyone and will kill anybody that gets its hands on. The number of fatal overdoses or drug deaths that I've responded to, it's staggering.
I'm living proof that if it happens to my family, it can happen to any family on Long Island, believe me. The other message that I have tonight is don't let the stigma freeze you in place. Talk about this problem to your neighbors, to your friends. Talk about it to your children, to your grandchildren. Let them know that we're aware of these problems. Now, this beautiful young girl is Hallie Ray Ulrich. She was 22 years old. She was my granddaughter. She had a scholarship and was at Pratt University as an art student. And she had a boyfriend, a bad boyfriend, who had a terrible habit, and that was heroin addiction. And he wanted to share his misery with her. She loved him, and she wanted to share his love, so she adopted his heroin to please him. And we fought the addiction for about a year. And then one time, her boyfriend injected her with what he thought was heroin. It turned out to be nearly pure fentanyl. She died immediately. She was very gifted, very talented, and very artistic. She painted a lot of figurines in Southampton, and when you drive out there, sometimes on Route 39, you'll see a lot of painted figurines. She was very good at that.
So one thing I can tell you is that we're seeing patients sicker and sicker on many levels, primarily mental health. We're seeing a very high level of acuity for mental health, and I'm going to speak a little bit about mental health because, folks, if I learned one thing, I learned that I treated about 1,000 patients throughout my career. And what I've learned is that a majority of my patients, drinking and drugging isn't the problem. It's their solution to the problem. And when we help them to achieve abstinence, right, which is no longer using the substance, typically the problem starts coming to the top. And we have to start peeling the onion back.
I used to work in this building, and in February of 2018, I actually organized the first fentanyl training for North Hempstead employees. And in April 2018, my own son, my only son, Alex, died of a heroin fentanyl overdose. He was 30. He was a licensed welder and was starting a new job. I really beg all the parents, especially, you know, if people maybe thought, oh, I don't need to come to that thing tonight at town hall. It's about fentanyl. We don't have to worry about that. That's a big mistake. I thought, well, let me work on like getting more Narcan out there. Now Narcan is in like 165 places in Suffolk County buildings.
I'm going to be a grandparent.
Yeah.
But the bad news is Aunt Lisa won't be there for her sister Allison. This saddens me. During that time period, I said, I have to do something here. My wife was a teacher in the Levittown School District, so one of her friends said, I got this for you. Got me connected with the superintendent, saying to the steering committee, get this out to the district. Not only did we get it out to the Levittown School District, we got it out to the Island Trees School District. The education and prevention factor has to ring, that bell has to ring every day.
We have to ask the question. If you have been self-harming, you have school phobia, you have anxiety and depression, how have you been coping for the last 6 months? Have you used nicotine? Have you used alcohol? Are you using marijuana? Have you been experimenting using substance out of grandma's medicine cabinet? You know, what are you doing? How have you been coping? And 9 times out of 10, adolescent children are very open.
We're spreading the message, awareness for mental health and wellness and co-occurring substance use disorder. We're helping to educate individuals and families. We create events. We have a mental health awareness march down Plandome Road, May 20th. We invite you all to come, participate as vendors. There's plenty of room. And we do this in Port Washington as well. We also have Zoom discussions on various topics under the mental health umbrella.
It's future social workers or journalists or elected officials or teachers or coalition leaders or future moms and dads and grandpas that they could have been. This is a national scourge. And LICADD considers, in partnership, in concert with you, we are responsible. We all know someone struggling or a family struggling right now. Take Narcan and visit their home. Call LICADD tomorrow and get involved on a volunteer basis. Call Supervisor DeSena and make suggestions what will change, Allison, Connie, what will change this community. Because you know, no one's a bad person. People are scared. Some people feel powerless. But Supervisor DeSena, you've given us a forum to change some of that dialogue tonight.
You know, you're real people. We all need to go home and tell our kids, tell our neighbors that we met people who went through this personal hell and are working so that other people don't have to go through it.